you, Anna. And I really appreciate the last session. That was amazing. Also, though, your comments about movement and how effective movement can be, in addition to other things. And that's probably why I love improv so much, because it to me, it's an active form of mindfulness. And it's what brought me together with these lovely individuals. I met Jennifer when I was curriculum director for the pre-clerkship students over at the Medical Partnership. And she was at the time and had been training for quite some time our standardized patients that come and help our learners learn. And Jennifer introduced me to Gabriel, and it was so nice being able to meet a playwright, because I don't think I had ever met or interacted with a playwright before. And I love being out of my comfort zone. And this has certainly put me out of my comfort zone in the most wonderful way that I can possibly imagine. So, if you want, I'll be happy to operate the slides.
Okay. Okay. All right.
Or if you want.
Let's see. Okay. So we are working on an interactive murder mystery using traditional playwriting methods and improvisation, devising a murder mystery, which is out of my comfort zone. I keep going, we need to have a structure, We're like, just breathe, it's okay, it'll all work out. So that's out of my comfort zone. And we're focusing it in the 19th century to look at women's experiences of pain and illness and disability. Not just the 19th century, but today. And these interactive mysteries, that's the frame of it. And these mysteries are most often, so in an interactive murder mystery, you ride a train, you ride a boat, you spend time at a historic hotel, and have dinner, tea, and solve a mystery. The audience gets to be the detective and solve the mystery. So these are fun. They're often humorous. They follow the cozy formula because people are wanting to have a nice evening out. There's usually a mixed audience, and they want to have a good time. They don't want to have to think too much, other than think through the puzzle, right? So these are often. Agatha Christie is the name most people associate with these kinds of mysteries, and the cozy mystery comes out of the British Golden Age of mysteries. So it's the interwar period between World War I and World War II, and these mysteries were they were very healing for Britain, especially the devastation of World War I. So this was a nostalgic genre, a conservative genre. They wanted to restore order. So they wanted to restore the social hierarchy prior to the war. They valued country life, country ideas over the anonymity and stress of the city, and prioritized traditional way of living over the over modernity and technology and science that led to much of the devastation in World War I. So the whole point of them was to have a rational puzzle that the audience can solve and put the world to rights again, right? Put everything back to rights again. So even when these interactive murder mysteries use darker forms of mysteries, like the later hard-boiled and noir detective fictions, or earlier, such as Victorian detective fiction or Gothic fiction, they always have a cozy feel to them. There's always laughter, and again, it's, they don't want to ruin somebody's night out, right? You don't want a big, gory, bloody body while you're trying to enjoy your prime rib, right? So they always follow that cozy form. And these mysteries often focus on key moments in history. So, and they're very tropey. So you don't want to have to spend time getting to know the characters. You want to already know who they are because you want to get to the business of solving the mystery. So, you think 1920s speakeasy. You already know what that looks like and the kind of characters are going to populate that, right? So this is that same type of thing. And there are popular points in history that are used in these mysteries. the speakeasy, 1920s speakeasy, 19th century Victorian era is always popular. World War II, 1950s America. These are popular moments for many of these mysteries, and it's a way because these periods help shape who we are now, and they also help us work through our anxieties that we're having in the present by safely doing it in the past. And where we can disrupt this is the tropes that we use. So these there are tropes. They're there for a reason. They're people we know. But whether it's in the improvising sessions where we're using many voices and many bodies to populate these tropes and give voice to them, or it's in the mysteries themselves. So a 1950s American teeny bopper rock and roll fan played by a woman in her 60s, you're going to have a very different interpretation of that mystery based on that. And then also the audience interacting. What is the audience bringing to it? What memories are they bringing to it? And are they dressing up? Are they portraying characters? So that can help disrupt time and place. And also because these are not performed on the stage and the audience interacts, the fourth wall is obliterated. So blur past and present. Fact and fiction, and it can be very trippy. I had a moment of slipping back in time myself when I was working on my dissertation. So it's, and this is places we can work on our anxieties, whether it's to restore the past and bring it into the present, like the mystery writers of the Golden Age, or it's to reflect on that past and imagine new possibilities so that we can bring those possibilities into the present. So our key moment is the 19th century, where we're looking at the development of modern medicine, modern policing, the mystery genre. All of these are happening at the same time, and they share a lot of the same things. They're all based on scientific method. What are you observing? What are you saying? What kind of evidence do you have? Does it back up your theory or not? And then coming up with a solution. And so that's what we're hoping to do, and we're going to reflecting on the past and challenging the past by looking at possibilities and hoping to make things better for women in the present. And then also, one of the goals I really like is being an actor in these mysteries. It's more than just being an actor and knowing how to act. You have to actually be really good at customer service because you have to read the room and know, can I joke with this guy here? Or do I need to leave that guy there alone? What can I do, right? So you have to be able to read the room and know what's happening everywhere and still portray your character and still play a role. So I want to see, how can that help healthcare professionals be better communicators?
And this is where medical improv has come in. And this is something I've been doing for nearly 15 years now. And Ed, my partner, who's in the audience, was actually in an improv troupe when I met him. And I always thought, oh, that's so amazing what they're doing up there. I really secretly wanted to try it, but then never would, right? Because although no one believes me now, I was a painfully shy child. I really was. And we started thinking about this a little differently when we moved to Grenada. There is a U.S. medical school in Grenada where we lived and worked for about 8 years. And Ed comes home one day and says, this really is a great tool for training for communication skills, for focused attention, for emotional resilience, all the things you want from a healthcare provider. And as a librarian, he started looking things up. So has this been done? Has anyone used it? And it turns out there were a couple of people up in Chicago associated with Second City. One was and is at the Feinberg School of Medicine up in Chicago. She is a lawyer, actually. So her background is in medical ethics and law. And her partner in crime, so to speak, is, and she's not kidding. She's family med. She's a family med physician. And they had started this medical improv movement just a couple of years before. So we started interacting with them. We later joined the Medical Improv Collaborative. And we have been offering our students this opportunity to train in this way. And it really is just a super fun way to come together. It's an active form of mindfulness. And when you think about improvisational theater, and I always leave out the theater part for some reason because I'm over at the medical school. We shorten a lot of things. It's important to get medical in there, so medical improv. But comes from improvisational theater as a tool for training actors. It can be a fun night out, but it is most certainly a discipline of focused communication. And what it has to do with medicine is they, of course, both require focused attention, intellectual empathy, commitment to collaboration. So training people in teamwork in a fun and games-focused way, and comfort with disequilibrium. This is actually a question on surveys, and a lot of times healthcare providers score a little lower on this because they want to have control over everything. They want to, right? That disequilibrium is often an area that's a bit lacking, especially in training. And so communication being important in medicine, obviously, when you're working with your team members, anytime there's handoffs, consultations, conveying instructions, getting input, working as a team, right? But crucial in speaking with your patients and their families. So even getting an actual history, you have to be able to be present, to listen, to form that narrative that both you and the patient and the family members can all agree upon. So in a sense, you're ensuring that understanding, right? Both your own and your patients and family members. So what can sabotage this? Obviously talking over the other person. So I don't know if anybody's been in a healthcare situation where obviously your provider is just sitting there waiting for you to shut up, right? And it can go the same way, right? So not listening, talking over. You don't actually communicate if you're doing those things. Taking cues. We all need to practice. These are skills that you need to practice, right? And this just happens to be a fun way of doing it. And denying. This is one that I was thinking about in the last talk, but other talks, especially thinking of anything with cognitive impairment. What happens when you deny that person who's cognitively impaired for any reason? Usually develops into a worse and combative situation, right? And so making sure that you don't deny. And that concept of yes and figures in prominently. Yes, and you're moving things forward, whether it be the relationship with your patient, the interactions with your team members, or any interaction that it's like, Jennifer contacted me, yes, and we can do this, and I love it. It's a way of being, right? But it's a way to keep moving things forward. And it's a fundamental building block, and of course, important to communication of any kind. So this project really appealed to me for a number of reasons. And when you think about the anatomy of an improv game, you're setting that context. You're having to work within constraints. We all do. We all have to work within constraints. And in this case, it would be the structure, whether it be set up by the audience or whether we frame it in a devising session to be set in the late 1800s at a particular location. But you're finding that central issue of the scene and you're making a resolution to the scene. So you're creating an entire scene every time you practice an improv game.
Okay, cool. So I'm the playwright.
I did not mean to be reductionist. It just still
I'm the
amazes
strange
me.
creature that
It still
wandered in.
amazes me.
So part of my name's Gabrielle, or Gabby's fine. I went to my grad program for playwriting, and I started doing devised work before that with the Annoyance Theater in Chicago. And they have like a set way that they create plays as an ensemble. They're like generated from, usually from like selecting a genre or maybe a clash of context of two genres. So we've got set beats, we've got set characters that are recognizable, and then we take on those and that embodiment, and we have these encounters with one another and see what happens. So I had come from that place when I went into my playwriting program. And part of getting an MFA in playwriting requires learning basically what I come to think of as reproducing expectations of what makes something a play and what makes something good and what makes something right and how to perform playwright. And when I left, I felt this strong need to investigate the things that I had been taught and the anxieties that had come with that knowledge. And so as an MFA, my background was in writing alone. And that idea of like, you go away and you go in the dark and the quiet and you come out with like genius art and then you give it to us and you go away again and we'll do it. So it's like weird like isolation and like lack of agency and also feeling like a machine. So devising for me was a way to like kind of come back to what I had originally been doing in Chicago in like a different way. So not necessarily just like we're gonna generate another play for the Annoyance, but as an act of meaning making, knowledge production, an act of community and reading together. But also for me, an important thing is this question of how can I develop a way to devise alone? So how can a playwright bring in that energy of devising, like in a community, but how can you do that by yourself? So how can we cross this bridge? Because I think playwrights feel separated from that. So devised theater is essentially an extension or an application of what Amy was talking about with improv. So devised theater is a collaborative act of theater making that uses improvisation to explore essentially anything. Like you're placing something on the stage, you're putting the spotlight over it, and we're going to examine it. And that could be a story, like a fairy tale or a myth, or even just like, a dominant narrative about people. A question, themes, an object, characters. And in the process, you create a new play. So sometimes devised theater is just described as a play. Like we're making a play from nothing. And I think it's important for us when we're thinking about ways that theater and medicine can connect is to kind of flip that it's not about the product is going to happen. We're excited for it, but it's not why we're doing it. We're doing it because we're curious and there's a nagging feeling that there's something I don't understand and that I want to know more. So just like what Amy was talking about with short form improv as having constraints, devising requires us to have constraints of time and place. Even just thinking about our acts of gathering and making the play, because we're not 24/7 in a state of making a play. We've got to mark that out with time and place so that we can be at our absolute top focus while we're doing it, and then we can leave and go, oh God, now I'm back to my regular self, which is like this. So devising for us was 3 Saturdays this semester that we had marked off for 3-hour periods. We also had a meeting of high tea at Jennifer's house using like all this vintage, like amazing antique recipes and plates. There's everything you can think of. Other things, flowers, like coming up with thinking about the ways that flowers communicate things in a bouquet, like we had this sight of like a meal, but the meal itself became an act of devising. So we learned something about the time we were exploring. We learned something about our relationships, characters. You know, you learn a lot about a person by how they interact with breakable, expensive objects, small things of food that normally, I mean, like, but I'm going to take tiny bites. Like, you become a character when you are encountering an event.
I even made my first flower arrangement. I'm 54 years old. I made my first flower arrangement, and I loved it.
Sorry, I'll just say these other things. So I wanted to just say that devising something that I think's exciting about theater as a site, but devising as a process, is that it is able to bring seemingly incompatible sites together. So I'll show you on the next slide what I'm talking about, but let me just say that for us, every time you devise, your approach to the devising is an extension or a reflection, or it emerges out of the subject you are studying. So for us, we were examining these intersections of the detective mystery, medicine, women. And so for me, the way I've been thinking about it is as though we are detectives. So when we create scenes based on seemingly like arbitrary prompts, every scene and every character is a trace. It's a piece of evidence. It's a clue. We're meeting somebody who is in this play. And so it's not an act of like, okay, I've got to be really smart and like invent something right now. And instead, it's a feeling of like, yes, I've been waiting for you. You're just who I wanted to see right now. And so every moment becomes this like really great boost of positivity because you're saying yes to everything. Even if somebody fails, the failure is part of the story. It's not that we did it wrong, it's that that's what's in this story. So just these elements of like every person we meet matters, every space is important and has a mystery to it and a clue and something unseen. Everything is the place of the crime. So there's an event to everything.
Oh no, it just brings to mind one of our medical students. We did a 7-layer dip. Anna knows what this is because she's in our faculty improv committee. But Jordan was sitting on the ground and she just starts drawing. And you had envisioned her drawing in blood.
No, not until the end. I don't like. She's definitely drawing in blood. No, she was like drawing in the dirt. But by the time we got back to that, it became clear that she was a murderer, and so it was like not dirt, blood. She's a child. It was like disturbing, but it was also because we've done this interview led up to that. I didn't start with the blood. So can I just? I don't have to spend too much time, but the last slide was just. So I pulled these just to use this space as like, this is another opportunity for us to devise. I pulled these images. These are works of art that are specifically from 1892, just to give a sense of the stage and the page can be a site for these seemingly incompatible sites, these people that you wouldn't ever put together. The place of a murder mystery is where like anybody from that moment can come in. Anybody's worldview, perspective can have a presence on stage and not be like limited to a certain group. So I thought that was interesting, and also just finding ways that heterotopia can be a medical term and relate to theater. So heterotopia in medicine related to tissue out of place, and heterotopia as a theater site is this place of separate yet connected to the world, and also where all these like incompatible sites consist.
Yeah, and it was really neat doing this over at the medical partnership. We had a bunch of pictures of women in medicine, even from the 1800s. on the wall by the women's restroom. And as we were doing these devising sessions, it was really neat to go to the restroom, look at these and see just how many women had had an impact. But then also thinking through bringing out how people experience disabilities. And that's another thing that we're doing in this project. And we wanted to say special thanks to everyone who has taken part in these devising sessions. And Grace is here in the audience too. And she will come up in just a few minutes and help us with a little bit of a demo if y'all like to see a demo. Okay, great. But first, before we go to the demo, we would also like to bring to your attention a workshop, which will be next week. And if you would like to attend, you can scan the QR code and join. Or if you can't get it from where you're sitting, just let us know and we can send you something. But we wanted you to do a quick check-in. So if you want to close your eyes, feel free to go ahead and close your eyes. And one of the ways that we introduced ourselves to each other at the beginning of these devising sessions was to think about something that was visible about us and something that was invisible about us. And for instance, I introduced myself as Amy, having a lot of brown that's now graying hair. And everyone can see that my hair is brown but turning gray. The invisible was that I suffer from severe back pain and have graduated from physical therapy 3 times now. I'm not sure how many times you can graduate, but I feel like I'm going for that record. So I would love it if you would think of something about yourself that you think is visible to everyone, and then something that you think is invisible. And how would you introduce that to someone? Would you feel comfortable introducing that to someone? Would you feel comfortable telling your healthcare provider? How would you do that? All right, thank you for that. Could I please have some, we'll ask for volunteers. We have volunteers planted in the audience also if no one wants to try it. But has anyone ever done improv that's in here today? Oh, awesome. Yay. So we'd like to do a demo for y'all of some of the games that we've been using, if that's okay. So Ed and Grace, would you mind coming up? Unless someone wants to try it. No, it's okay. We'll come up here. Yeah. All right, so the first game that we will demo is going to be 60, 30, 10. Has anybody heard of this one? It takes on different time frames. You can change it to whatever you want. That's one of the beautiful things about improv. But our 2 performers are going to construct a scene, and they're going to perform it in 60 seconds. Then we're going to ask them to perform it in 30 seconds. And then we're going to ask them to perform it in 10 seconds. And one of the things that we use this for in training healthcare providers is to think of that. It's narrative building, it's focused attention, but it's also making sure that you are extracting the important information that needs to be extracted from a scenario or scene. So does that make sense to everybody? Okay. All right. We will go anywhere you want. What is a very large location that these 2 players will conduct a scene in?
Mercedes-Benz Stadium.
Ooh, the Mercedes-Benz Stadium. I like it. I'll grab my phone so I can time. And who are these 2 individuals to each other? What is a real
teams?
Ooh, fans of opposite teams in the Mercedes-Benz Stadium.
No more bets. There's no bets as to how it's.
I've
forgot this was happening.
And this is the beauty of it, right? We step out of our comfort zones. We learn to pivot. We won't learn to think quickly. We learn to take failure bows, which I am excellent at, all of my failures. And we get comfortable with that. This equilibrium is that here.
Yeah.
All right. Okay. I will time you in 5, 4, 3, 2, 1.
Falcons scored another touchdown in your face, Patriots fan.
Give me like 2 minutes, bro. Okay. Back up.
He's going back. He's going back again. I'm so sorry.
I'm not.
First my beer spilled. Now you knocked me into Grandma.
Sorry, Grandma. Not sorry, Grandma.
Look at her. Look at her lying there on the ground because you knocked me into her.
All right, Grandma. Hold on.
Want a beer?
I think me and Grandma are gonna be friends.
First, you take my joy from the spot. Then you take my grandma.
I think that's a minute.
Over here and think about my pain.
3, 2, 1. Nice. And that is 60 seconds. And it's interesting how long 60 seconds is, right? Especially if you're up in front of people performing, right? But yes, it can feel like a long time. And we're always looking for efficiency in a lot of things that we do, right? And it's interesting how much you could pack in just 1 minute, right? So, all right. We will try this in 30 seconds. In 5, 4, 3, 2, 1.
In your face! Falcon scored on the touchdown, Patriots scum!
Just give him a minute.
No! First you knocked over my beer, then you knocked over Grandma. Don't laugh at her!
Sorry, Grandma. Okay.
She's never gonna be the same
I'll
again.
get her.
I'll get her up.
Oh,
Grandma, are you okay?
Grandma's fine. I think Grandma and I are great friends.
No, first you took my beer, then you took my grandma. I didn't think about this. Oh, let's be friends.
That one fell short. Did they capture all the essential elements of the story? Yes.
When you guys only have 10 seconds, can you remember to knock him back so he has a reason to fall back?
Incredible, yeah. Justification.
All right, players ready? 10 seconds. In 5, 4, 3, 2, 1, go.
Falcon scored on the touchdown in your face, Chris. Oh!
Nice. Very nice. So you can see how when we have, don't go anywhere, you can see how when we have prompts and situations based in the time frame of this interactive murder mystery, we have different scenarios being pre-prescribed, the amazing things that can happen. And then when you shorten, you get those essential elements down, and so on and so forth.
Can we kind of like unpack it a little bit?
Yes, please.
I love it when you. Having a playwright is so much fun because we're just here having fun and then you just like create worlds out of it. And it's
I'm not going to create a problem. No, I was just thinking, okay, so thinking about what did y'all notice? This is what we would do in the session. So every time we'd stop, like it's easy to just be like, and next thing, and it's like, let's stop and linger here. So what are some of the elements y'all notice that can you flip so you're back where you were?
Yep.
So think about like, this was clearly set here, but what could we lift from this and place in 1890 that would make sense? what happens when a line like, first you take my grandma, then you take, what was it? First you take my joy, then you take my grandma, and now I've taken your beer. If you lift that dialogue and place it in a murder mystery, like what happens to it? So part of devising is defamiliarizing, decontextualizing lines from like their origins and then putting it somewhere else and see what happens. So if we were in our session, maybe we would try that. Also, just thinking about this is a super small place, and I had no idea you would be able to have like at least 3 locations within this. So you start here. He's very aggressive, like comes at you, and then shoves. We create a new space with grandma. We create a new person who's now in a hole for some reason. And now crossing, right? You cross. Did you drag her body? Okay.
No.
Now we got down. So now we get levels. So now we get power levels. Whereas before they were equals, now we're like somebody's on top. And when he comes up, we're friends. It's kind of a, I'm on your level again. I'm like, it's like attaching to you. So, so anyway, they're just all these elements that we can take with us to the next thing. There's no wasted writing. Right. Yeah, I think.
I think you created worlds.
And we're all learning so much through these processes. We love it. My background is in viral oncology, and so I insert all kinds of weird virus things all the time. And spoiler alert, your microbiome is controlling everything. But another thing that was weird is one voice. And this helps explore what was talked about a little yesterday with that duality, if you're in a duo, or just different sides or parts of personalities and things like that. And would you like to do one voice with me and Gabby? And then Grace can be paired up with Ed. Perfect. All right. So in this construct, Gabby and I are one person. So when we talk as one person, not having any idea what we're going to say. So it's fun. And Ed and Grace are also one person. All right, so where are we? What's a small place we can be?
Bathroom.
Bathroom. All right, we're in the bathroom. Who are we to each other? Any relationship?
Mom and daughter.
Mom and daughter. All right. So mom and daughter
Towards the audience.
in the bathroom. So we can
Yeah,
it's fine. Are you done yet?
Did
you know
that Mom, I need a minute. We have to get going. No.
Okay. All right. It's always amazing when the same words to me come out. And we used this one. It was really memorable for me because Gabby and I were paired up then too, and we were on a train. And one of the duos was the murderer.
But we didn't know who.
Oh my gosh. And we were playing mind games as a unit, and it was really interesting.
Yeah, it was fun to think about the gothic element of the double through this game, the improv game.
So I hope you enjoyed those demos. We all love co-creating and learning together, and so I think that's why this is so much fun for me especially. But any questions? Do any of you use improv in your teaching?
I have a question. How do the students respond to it, like medical students who may not? How do they start with it? How long does it take them to get, be okay with the disequilibrium?
What I've found is that
Many medical students are very unsure of it, especially at first, but then we always run into a couple of medical students who really enjoy it. But you bring up a really interesting point. So when you're doing this work, it is a big difference between doing this work with self-selected people that really want to be there and people that don't necessarily really want to be there. One of the things that Amy and I have done a couple of times is work with the residents over at St. Mary's. And, you know, they're internal medicine residents. They're very driven people. They're very smart people. You know, you give them a task, they'll do it. They're not necessarily improv people. So that whole process of getting them over the course of 3 hours over the finish line could be interesting for everybody.
Oh, but a lot of them tap into their own skills, and it's beautiful to see that. And it's nice to see them enjoy that. But Grace, you can speak personally from your discomfort at first too.
Yeah, I actually was forced to do improv, so it was not by choice. It was a little painful at first. Of just like, this is way outside of my comfort zone. This is something I never would have done for myself. But it was part of I was a camp counselor for a mini medical school program that we were doing, essentially like a summer camp for high school students. And it was part of the curriculum, and we're like, well, okay, here we go. And after like week 3 or 4 of being painfully committed, because you're with high school students, and if you're not bought in, they're gone. So it was out of necessity that I'm like, I gotta buy in. And so by like week 3 or 4, and Jordan, who's a little shyer than I, and so I was like, well, it's okay. So, but by week 3 or 4, we started to really enjoy it, and then started to see our confidence build in the skill set, and then it started applying to my like clinical rotations, and I started to bring it into like the listening aspect of it, and the communication with my patients, and even if I'm having a really crappy day, that's not my patient's fault. And so I can leave that at the door and show up into this clinical exam room as the best version of myself and the best medical student that I can be. And I can come back to all the things. And we all have to do that and compartmentalize. So I found it really helpful in the clinical scenarios as well. So it's been fun.
Fast forward to March, we were at the Gold Humanism Summit doing a workshop, and each of 4 of our students led a game. And we said, we don't know if there's going to be one person that shows up or if it's going to be 30. We ended up having 40 physicians crammed in that room. So we're so excited about it. And I'm looking over when it comes time for Grace to lead the game. She steps up in the chair and she's talking. I have this picture of her where she's like this, and you could just feel when she knew everyone was right there. And I thought, I almost cried. I just thought that was beautiful. And she just did such an amazing job and was so confident. And I could just see the benefits of that. So.
Well, I teach in clinical skills at the medical school, and I can tell you they're doing improv without knowing it all the time. And so that's where it comes in for us a lot as a physician is in those patient interviews, like Grace was saying, because you never know what they're going to say to you. You know, you could be in the middle of like, oh, I think I'm in here for one thing, and then all of a sudden they throw something else at you. You got to shift quick, and that's where I think this can be really helpful.
We do a lot of role play in our small groups, and one of our students, I was a bit taken aback, but we see this all the time. We were doing the role play, and the patient says, I don't understand, or could you ask me about this? Or could you tell me about this? And the student says, can you wait a minute? I need to finish what I'm saying. But all the other students in that group said, hey, probably don't want to do that. That shows you're not really listening to your patient. That shows you're not responding to your patient. And so that's a lot of functionality.
Also, like, effects for the person, right? I mean, you feel lighter and you feel happy. This sort of...
Yes. So it also, their communication, but also in treating the patient too. So we have an acting faculty who injured his leg, and the doctor had taken some improv courses, and the idea of yes and made him think, okay, this is the thing you do for 90% of the patients, but it's going to vastly affect the function of his leg, and he's an actor. He has to be able to use his body. So he used and to improvise a different way. So it affected just the treatment itself of the patient and the way they think through it.
In a lot of the more conventional approaches in drama therapy, for example, we have clinical goals. In psychodrama, we have mentors and intentions. And yet, this is an open space. So I'm just very interested in your reflections from a therapeutic point of view. Are we in fact too goal-oriented in a lot of art therapies? Isn't the open space quite a useful place for things to emerge and be dealt with? I'm just interested in your reflections on that.
You have a great answer for this about it being an active form of mindfulness.
Yes, yes,
Your turn.
absolutely. But having that space and allowing that space is something people are super uncomfortable with by and large. And you're absolutely right. Learning to be comfortable with those openings, learning to then see what fills up those openings. That has been tremendous for me in doing this all these years. I love it. I feel guilty because I consider it a form of therapy for myself, right? I have to leave everything at the door. If God forbid my student asks me something and I'm not ready, but by a few minutes into each session, it's all right. The expletives that come out of my mouth. I think, oh my God, my students were there. And I walked myself back through, and there was a particularly bad one. I walked myself back through. This is the safest space we create. If I'm trying to do that for others and I don't do it for myself, then I'm a hypocrite. And why can't I take advantage of that? And that's very freeing. Very freeing.
You can't make others safe unless you're safe yourself. So in other words,
Exactly.
yes.
And these interactive mysteries also create safety nets for you, so that you know there's going to be a solution. You know everything's going to work out. The world's going to be direct. You know the mirror is going to come out, and everything's going to be resolved. At the same time, you get to play with ideas and play with thoughts safely in this sort of liminal space between past and present, and fact and fiction, and play with your identity. And then you can walk away and leave that behind you. But you've created something about yourself, you've learned something about yourself, and you come away a different person.
Hierarchy games are quite fun.
I think just for me, like as a writer, like therapy was never super helpful. I think probably different kinds of therapy would, but the act of completing a story and writing the end gives you something as an object, so you have a sense of like, I made something that I was feeling created something positive, but it also gives you something to come back to and encounter later in a different way. So it's not just like an endless amount of writing that has no context anymore, and it's also locked into a certain time and place in your life. So it ends up being kind of a timestamp. So that for me is like why I really like this kind of improv and meaning making.
Okay, do you have Monica has one last question?
Yes, you
So little
you saw it. I guess I want to share a problem. I'm really curious because I've been working on projects with arts-based methods, training STEM students and especially environmental scientists. And it's exciting that there's research happening, showing kind of the benefits or effects of this kind of training. But now there's a need for research into the longitudinal effects. And I'm curious, this is something that surfaced in our project. We don't know, is it gonna stick? It seems to be fun while we're doing it, but what are the conditions that allow someone to really take this kind of thinking into their long-term practice, or conditions that almost counteract the great stuff that you did?
Right, and there's a good bit of not necessarily quantitative but qualitative research around those questions, where you have practitioners who have been practitioners for years and even decades, and what they get from that and how it continues to help them. There are numerous papers on that, but you're right. We all want longitudinal sort of outcomes-based research to show these things. And people are starting to be able to do this. This is something that has only gotten going in the past 20 years or so, with medical improv in particular. And so we're at the dawn of it in a sense, and it's really exciting.
Thank you.
Thank you all so much.